It's really because of the legality of it. I believe the process, it's progressed through the legal system. Initially, euthanasia was viewed as actually murder. Through a series of court cases, the definition has progressed to physician-assisted suicide. So physicians could actually help people that were in that had terminal illnesses that really their demise was going to be very unpleasant and painful. So it has been a process that has finally came to been in definition of physician-assisted suicide. Euthanasia is actually just ending somebody's life. If you think about animals, we give them injections. Physician-assisted suicide, as we had talked earlier, there's several different types, but essentially it's a way the physician actually is able to give the person the tools and maybe medication, but they actually don't administer the medication. The patient does it themselves. The person that's trying to end their life does it themselves. Because it makes them truly feel like they're playing God, and that's not a position I believe anybody really wants to be in. I believe it's religious beliefs, truly. Everybody has their own way of looking at religion, and some people have very strong religious beliefs that it simply is wrong to end your life. Again, you're playing God, because really nobody can predict when they're going to live, what they're going to, what kind of illness they're going to have. That it really just is in your cards, so to speak. I believe that it should be an option, because in the end, a person is going to pass. When they're terminal, we know they're going to pass, and certainly the thought is that it's relatively soon. So you're really, the reason you would be doing it is to prevent suffering. I believe with very strict guidelines that should be an option for some people. Somebody that's mentally ill should be protected, and that would include depression, major depression. Many people suffer that, and certainly through illnesses, terminal illnesses, they're going to have depression, so that makes it very hard to really determine if somebody, that's their true wishes, or if it's depression. And certainly anybody that's has some sort of dementia or mental incompetency, that is a concern of mine. But with proper guidelines in place, I think those barriers can be minimized. Well, the one that I've heard most is first do no harm. But again, I think it's the way your perspective. Is it harmful not to ease somebody's pain? And truly, it is, and actually it's illegal. That's why when You're caring for somebody that's in pain, you have to address that pain. That's why I'm not sure that it's widely known, but the fifth vital sign for patients, vital signs are temperature, blood pressure, heart rate, respiration. The fifth one now is pain level, and that has been in standard practice for a few decades. So I would argue that not helping somebody that is having horrible pain, if you can't help them any other way, then you are doing them harm. I mean, if you withhold ending their pain, isn't that doing harm, I guess is the question. Saying, okay, we have decided that it's okay to assist somebody when they have a terminal illness to help them pass earlier than what they would have. So the question is, are we going to have next? Are we going to say after you reach a certain age, you are no longer viable, and at a certain age, we should just end your life?